This is Inner Healing Paths podcast. Here we discuss the healing of the mind, body, soul, and spirit through a variety of different paths. We have emotional and spiritually minded conversations centering on ancestral healing, psychology, astrology, yoga, meditation, magic, and indigenous spiritual practices of the world. I am your host, Rosa Shetty, and I am so happy you are here. Welcome. So today's episode is with my friend Diana Little. She is one of the most real, genuine souls I know. I want to thank her for coming on and sharing her story, sharing about her journey. We talked about the healing path of psychedelics. We talked about specifically psychedelic assisted therapy. We talked about having spiritual awakening and tapping into higher levels of consciousness and healing. And it was such a rich and juicy interview. I know I learned a lot, and I know you will too. So without further ado, here's the interview. Take a listen. Okay, thank you, Diana, for taking the time to be here on my new podcast. So before we get started, I want to give a brief introduction to our listeners, just so they get to know a little bit more about you. So Diana Little became a licensed marriage and family therapist in the state of California in 1996. Since beginning her master's program in 1985, she has worked extensively in addiction treatment and multiple psychotherapeutic modalities. She has an extensive knowledge of psychedelics and their psychological benefits. This learning was founded in her graduate school work, which focused on the study and practice of transpersonal psychology, and looking forward to finding out more about that. She says her greatest learning is from her own personal experience, and both personally and professionally, she is very much deeply rooted in Buddhism and humanistic psychology. So welcome, Diana.
Thank you for having me, Rosa.
Yes, thank you for coming on. I'm so happy that you're here. So tell us a little bit more about how you discovered your calling to do this work that you do.
Ever since I was a tiny baby, I wanted to be a counselor, a psychologist, something of that nature. And I'm exaggerating slightly. But I do come from a long line of drug addicts, alcoholics, bipolar disordered, all kinds of, imperfect human beings with pretty serious problems. And so, like most children, I want to fix the family.
Right.
So that's where my work began, and my study began was in trying to navigate a highly dysfunctional and violent family system.
Almost
that included drugs and alcohol, as I mentioned. So
trying to process your own stuff, in your family.
Right.
Yeah.
Exactly.
Okay. And where are you from?
I was born in California and moved a great deal. My parents split when I was 8, and my mom married my stepdad, and we moved to Indiana, Massachusetts, and then New Jersey, which is where I did my college and grad school work. Was at Kane College, now Kane University, Union, New Jersey. And so that's a little bit, that's where I come from. And I came back to California in 1990. And that's where I began to pursue my license as a marriage family therapist.
Okay. Oh, wow. So you have so much experience. I mean, I didn't realize that you've been doing this almost 35 years, right? I mean, in this mental health field.
Yeah. Grad school started, and that's a whole sort of a miracle story of how I got into grad school as easily as I did, and into the program that I did. Yeah. It was like doors just opened. Boom, boom, boom.
Wow.
I barely had to knock. And as I said, I always wanted to be a therapist in some capacity. So yeah, when I started my grad program in 1985, and that was in transpersonal psychology, as you mentioned,
Mm-hmm.
which was just the most perfect fit for my own interests
Yeah.
and inclinations. And it
Mm-hmm.
just was, coincidental or meant to be, however you
Yeah.
want to look at it.
Yeah. Okay.
So yeah, that's when my work started, was 1985.
Can you tell us a little bit more about transpersonal psychology and just what does that involve? Sounds so interesting.
Yes, I love transpersonal. You don't really hear it talked about very much. It certainly does still exist. And, in recent years, the word or the prefix trans has come to mean a lot of different things, and as it tends to have it seems to be sexually oriented in its meaning. And in this case, not at all, although, certainly encompasses every aspect of our humanity. So it was Maslow in his hierarchy of needs actually added beyond self-actualization. Shortly before he died, he added another level, which he called transcendence, which is to indicate the evolution or transcendence into an even higher level of consciousness beyond self-actualization. So it takes the knowledge of the self and expands that into a greater consciousness, a universal consciousness in which we are all connected. We are responsible for our personal evolution as well as the evolutions of each other.
Yeah.
And that also encompasses work with psychedelics and any other sort of modality that's going to facilitate that transformation, that higher consciousness. And very much in alignment with my also predisposition to Buddhism. So I started studying Buddhism as a teenager and declared myself as Buddhist at some point in my 20s, I think.
Oh, okay. So very early.
Perfectly. Yeah.
Very early on, yeah.
Raised Christian, and I was very devout in that belief. But I always had more questions. Christianity is very faith-based. Where Buddhism is much more experiential and much more addresses.
I never thought about it like that, but you're right. Yeah.
Yeah. And it addresses suffering in a way that Christianity never really addressed for me. Having faith wasn't enough for me. I needed to have knowledge and experience.
Okay. And that's the part that the going into transcendental psychology or transformational psychology. Transpersonal. Sorry.
Yeah, don't feel bad. Like nobody's like, what's that? But
it just kind of, like you said, just fell right in alignment with what you were already searching for and in life and the healing that you were searching for.
I mean, it was kind of a miracle. The short version was that before I went to grad school, working with my bachelor's in psychology, I got a job working in a methadone clinic in Newark, New Jersey.
Oh, and this was how long ago?
So that would have been 1984.
Okay. Yeah.
A very prophetic number, right? So in a methadone clinic in Newark, New Jersey, I think I lasted a month. There. And I mean, it wasn't therapy, it was administering methadone and then doing a checklist of, okay, you're next heroin, are you? Okay, off you go. So it was a very unhappy, tragic kind
Diana, and methadone is used for recovering addicts to heroin, right? And
yes. Okay. I'm sorry. Yeah. I've been in it so long, I forget that. Thank you. Methadone is used in the treatment of heroin addiction.
Yeah.
It's a substitute addiction, and it's in fact a much stronger addiction. It's much a harder addiction to break. But methadone is legal, so heroin addicts can get methadone to sort of hold them over. Okay. But it has a very low success rate. I don't know, frankly, any heroin addict who has actually gotten sober using methadone, though they might be on methadone for many, many years, and they may be much more functional, and they call it methadone maintenance. But I'm sure there's some case where someone actually has gotten sober, but very, very unlikely.
Okay. Yeah. Well, thank you for that explanation.
Thank you for
Yeah.
asking. So that compelled me
Mm-hmm.
to go to grad school. And so I went back to the school where I did my bachelor's, Kane College, now Kane University in Union, New Jersey. And I just walked into the admissions office and said, do you have a grad program in psychology by any chance? And they said, well, yes, we do. Would you like a full scholarship? I thought, yes, I would.
That's
and
amazing.
It was incredible. Would you like a little job at the college counseling center for a stipend? And so, my God. So I began working in the college counseling center, doing my graduate studies. And in 2 years, I completed my master's, and then I already had this 2 years of clinical experience while I got to do that while studying transpersonal psychology, which it was a perfect, synchronicity of events.
Right. Oh, wow. So how did you get how did you get familiar with psychedelics and can you tell us a little bit more about psychedelics in general, but how did you get started in that? And so how did that happen?
Well, I will be completely honest with you. And as I already mentioned, I come from a long line of drug addicts and alcoholics. And in my own struggles with depression, mostly depression, some anxiety, because, who doesn't have some anxiety? Who doesn't have some depression? But I was very deeply depressed and codependent, also coming from the environment that I came from.
Right.
So looking for remedies, and I did find Buddhism very early on as well. And some of the Buddhist teachers of that time did also talk about the psychedelic experience.
Oh, okay. Really? That's interesting.
Yes.
Okay.
And like Jack Kornfield comes to mind. He writes quite a bit about that. And, there are others too. So in college, for doing my bachelor's, I did stumble across some of the writings of Timothy Leary. And Timothy Leary, who now I have learned much more about, he was kind of a shady character and had connections to the CIA. But Timothy Leary famously said, tune in, turn on, drop out. He was a professor of psychology at Harvard University. And he gave a lot of his students and others LSD, and then sort of, talked them through, worked them through the experience. And I'm sure he did a lot of harm, but he did a lot of good as well. So Timothy Leary, besides tune in, turn on, drop out, he also said, and I think this is pretty much a direct quote, he said that LSD has a universal experience of making the user feel at one with God.
Oh, wow. Okay.
And that was what got me. Because in that time, in a search to overcome my depression and what I didn't even know was my codependency at that time, and a sort of a desperate spiritual search, also sparked by my initial investment in Buddhism, and everything that I was learning on that path, it was a natural, right? So I found a way. I found a friend who could get some, I got some, and I found it to be incredibly helpful, incredibly enlightening. And as Aldous Huxley would say, it blew open the doors of experience.
Wow. And I think it's the ideal way to come into psychedelics is to experience it yourself, right? To not just read about it from an academic perspective or as a therapist, but to actually experience that, to go through that journey, to do the healing. And I think that's the best way to even be introduced to this field of psychedelic assisted therapy. Yeah.
And in retrospect, how wonderful would it have been to have a real guide in that process? However, I did, find my own way, and I did learn so much, and definitely made some mistakes, and there were definitely periods of time when I was probably abusing it. And for all of the enlightenment and, sort of revelations that it provided for me, truly like deep insight and understanding and acceptance and love that I experienced. It did not stick in and of itself. It did not stick. I was valuable for sure, and things about it certainly did stick with me that I could access. But as far as my overall recovery into, an actualized and, generally happy individual, that also came as a result of further study and therapeutic work, with transpersonal, with Buddhism, with my meditation practice, integrating, that new knowledge into a fully formed, sense of self. And as a therapist too, it has very much informed my work as a therapist. Though I've never been even, legally or, remotely, sort of allowed within the scope of my license to say, hey, maybe you should try some hallucinogens. But it has still informed my practice where I understand people's experiences on a different level.
The field is changing though. I mean, who knows how it's going to be in the future, but I definitely, even the interest in psychedelic assisted therapy or just psychedelics in general, I feel that is pointing to that shift and openness to many other ways of healing, because that the truth is, and that's why, I call this podcast Inner Healing Paths, because there's so many different paths that lead to healing, and ultimately it is a journey, and through our journey we are at liberty to choose and make decisions about what we feel that we need at different points in time in our life, because it's going to be different, right? What you need now might be very different than what you will need 20 years from now, but nevertheless you're still healing, right? It is still a lifelong journey, I believe. It's a journey, not necessarily a destination. I know it sounds cliche, but it really is, right?
Yes.
So so when you mentioned, Diana, that it didn't stick, what part of it did? So I guess, what did stay with you? What part you feel that you've been able to hang on to and it has helped you to this point? Is there just in concrete terms, like what did you feel that helped you the most from your own experience with psychedelic?
That's a really good question. As I said, in my dive into Buddhism, because I found it, much more directly addressed my own personal suffering and the suffering of humanity. My hallucinogen experience, as with my meditative experience, brought me so quickly, though. Meditation takes a long time. Meditation takes a lot of practice. And I do believe that is it's definitely an essential part of my path, has been. The hallucinogenic experience brought me right there, right then.
Okay.
And so I had
what do you mean, like right there, like in that state of mind, like that outer state of mind just brings up what specifically?
It gave me access to higher consciousness in a way that was so clear and so real. And this is, I believe, one of the great metaphysical truths is that we will never be able to put the absolute truth into words. Absolute understanding, knowledge, consciousness, call it what you will, cannot be translated into words. It's an experience.
Yeah, I believe that. Absolutely.
So having the experience, I have that knowledge. And then a lot of the integrative work is sort of trying to, as best possible, put it into words so that it can be more accessible to others, using it as, therapeutically, and to remind my own self, but remember that experience of being there, of knowing this, and breathe and tap in. And so it facilitates a much quicker access, I guess, that conscious connection where I know, and I also know I can't really put it into words.
Right. You can't unlearn or unknow what you've experienced, even though you can't put it into words, but it was this transcendental experience, right? That it just shifted and change things within you to your core. And when it comes to, and you mentioned earlier, there's things that didn't stay and that didn't stick, and that was it things that you wish you were hoping to heal through psychedelics that it just didn't do that for you, or it just over time it just lost its power in that regard?
Yeah, that's a great question too. So what didn't stick was the happiness, because I would have these incredible experiences and I would just be, on top of the world, like, oh my God, like I know it, I feel it. I am it, But then of course life gets in the way, and I had the issues that I went in with around codependency and depression. So those issues, those reactive kind of feelings came back circumstantially. And so I would pull on that experience, but then I also needed to incorporate meditation, and therapeutic interventions to make them more sort of solid within myself, and then at some point I can't tell you the day, the time and place, but at some point there was a real shift. I'm like, oh, I'm okay now, I never have to go there again. I never have to be that depressed, that reactive, that codependent. Those tendencies are still in me, but they've become such a small part, almost a memory, so that's what I mean. They didn't stick.
Yeah, no, but that makes sense. I in my own personal practice with clients, I do parts work, internal family systems, which talks about just the fact that there's different parts within us and these parts have their own personality, their own agenda sometimes, and they're there to protect us. So what you just said right now, that part is still within you, right? There's still that tendency. I think you said that tendency still there, but it doesn't have to protect you anymore. From an IFS, internal family systems perspective, it doesn't have to take over.
It's there, not my identity,
and it no longer takes over your life, right? The depressive part, or the anxious part, whatever it may be, it doesn't need to be so at the forefront. It's still there and you can see it, but it doesn't take the lead, which for a lot of people struggling with depression, with anxiety, these parts within them take over, right? And they run their life, and of course it cause tremendous pain and hurt. So
yes, and the same kind of vein, pun intended, it's an addiction to this, this identity, this this neuroses, it becomes self-fulfilling in a way. I'm depressed, and so I can always find any number of reasons to be depressed. I'm codependent. There's so many reasons that I could put on that. So many people I could blame for that. But that is not who I am, and it's not my identity anymore.
And that's part of healing too, right? To be able to have the privilege to say that, right? Because when you're in it, in terms of the deep depression, you don't even know that's an option, right? You don't even know that you have that part within you that you can just put, that you can talk to and put to the side, and and it doesn't have to take over your life. Like when you're in it, you don't have that perspective. So part of healing is to have this perspective that you just shared, and to say, I can control these elements of my life. I do have a say. I do have a choice to a certain extent.
Well, that's an interesting point. The control thing, and this I would say has been very much revealed to me through this work.
Okay.
That is not a matter of control. It's a matter of acceptance.
Oh, I like that. Yeah.
Okay. So I can't.
That. Yes.
Yeah, I can't control my depression, but I can accept it. And by accepting it, I can work with it. I can see it for what it is. Quite clearly, as like an aspect, as a reactive emotional state that I get into for various reasons, mostly people related, but not necessarily. Could be environmental. There's all kinds of things we could get good and upset and depressed about right now.
Yeah.
And truly, this work has kept my head above water, to recognize that there is, that this is what I can do, and this is where I am at, and this is the help I can provide, and that keeps me afloat, but it is not control. And that's a very significant and delicate shift.
Okay. So it's coming to a point of acceptance, right?
Yes.
Yeah. Oh.
And I think it was Maslow. Maslow that said nothing changes but through acceptance. So all of our resistance, which is futile, resistance is futile. We can say no, certainly. No is much more powerful than resist, by the way. That's a separate conversation. But acceptance creates a condition for change, because then we can see clearly what it is we're really working with. We're trying to control it. If we're resisting it, if we're putting it in a box and up on a shelf,
no,
it will only grow stronger.
What you resist, right? Sometimes it persists. It keeps coming up.
That's right. Yeah.
I want to go back to something you mentioned earlier with you mentioned how at some point it became too much. It was almost addicting, that that journey with psychedelics, and that brings up for me, just it's interesting because I think a lot of times people don't realize that part. They just think of the healing, it's because it's promoted in that way, right? That you can access these spaces within yourself and higher consciousness and tap into all of this wisdom, and so you it's very easy to just lose sight of the the shadow side of it, right? The other side, which is it's still a drug, right? And because there is so much good that can come out, it can be also very addicting. And so thank you for bringing that up, because I don't think people, especially because it's new and there's so much going around on this. People are curious, and I think this is the reality that this happens, right? You get addicted to this.
Well, in a sense, and yes, that is a very important point. And as I said, I was on my own. I mean, and I was studying transpersonal psychology. That's once I got into grad school, but I was well into this before grad school. Just in my search. And it definitely did get out of hand. I was young and searching and, having a ball also, it was also sort of like a party thing for me too. So I got way more experience with it because I was just left to my own devices. There was no such thing as a guide, not that I knew of. There were shamanic guides, people doing, sort of peyote ceremonies and ayahuasca ceremonies in parts of the world, and, probably even not that far from me, but I had no knowledge of that.
Right.
Or I certainly would have gone that way.
Okay.
So I was, kind of a bit of a wild child. I was also very young. I started college when I was 16.
I didn't know that.
So the first time that I tried acid, I think I was 19. So, I mean, if I'd had, better guiding and supervision or whatever, I would not have been quite so reckless. And then there were other, it was peyote, and there was, psilocybin, and
what is peyote?
Peyote is a cactus. It's from a cactus.
I think I've heard it peyote. It's Spanish, right? It's Spanish.
Sí.
Okay. Yes, I've heard of that. Okay.
Yeah, and there are subtle differences, I'm sure, in how it affects the brain and the psyche, and but generally speaking, people who have tried lots of different hallucinogens will say that they do tend to bring you to the same place. And some are more ritualized, some are cleaner than others, for sure. But so where I kind of went sideways with it was due to the circumstances and my own suffering, making me so desperate in the search, and then once I found it, I became extremely enthusiastic about it, and then overly enthusiastic about it. But then just, by the grace, my lucky stars, however you want to call divine intervention, I was very well protected. And I can see, looking back, at many points when it could have gotten very bad.
Oh, okay.
But I just, again, by the grace, I am not an addict, and I've never been. So I have nothing to account for that other than good luck.
Yeah.
Because my family genetics. So when it did start to get, particularly dodgy, I just naturally drew back from it. Okay, that's enough of that. And pulled back. And then getting into, my own therapy and, deeper into my Buddhist path and then into my own professional practice as well. All of this has contributed, to stabilizing all of that experience and preparing me to use it to help others, and so, and as you mentioned, it is becoming more acceptable. And right now in the state of California, there are MDMA trials that are happening. And there is, as we talked a little bit about, there is ketamine assisted psychotherapy. And that one is fully legal and approved. And
there's clinics, right? There's ketamine clinics that you can just, if you meet that criteria, you can actually pay, right? I don't think our insurance is covering that now. No,
not that I know of. There may
a lot
be
of these are cash paying.
There might be some exception to people with, sort of gold standard insurance, perhaps. But I doubt it. I am connected to a clinic in Pasadena. They're called the Southern California Infusion Clinic. And the guy there, his name is Greg Wright. He's a nurse practitioner who's been doing ketamine infusion starting as he was a nurse practitioner anesthesiologist. So he gave ketamine for many years for surgeries and for pain management.
Okay.
And then in more recent years, they found that people undergoing ketamine for whatever reason come out the other side of it happy. And they stay happy for sometimes months at a time. And then if they are predisposed to depression, the depression will come back. And then they might do another. Now, so in ketamine infusion treatment, they typically do between 3 and 6 sessions. And then they might do like a tune-up session in a year or two. But often the effects are lasting. They may never come back. And then the effects are going to be more lasting combined with psychotherapy, of course.
Absolutely.
When you can talk about it, process it, just as that solidified, my own experience and learning, it will for these patients as well. So I'm very excited about moving forward with ketamine infused assisted psychotherapy.
Especially because that's right now what is available, right? What we can, for patients that want to look into this is something that is that you can't, it's illegal, at least I don't know if everywhere, but at least in California, right?
Yes, in California and many other places as well. I can't list off the states, but it is completely above board, legal, supervised,
that's
and
the key.
safe and safe. And as far as I know, there hasn't been one bad reaction.
Okay. Yeah. I want to go back with the ketamine. So I know that I don't have a lot of knowledge in this regard with psychedelics, but the little bit that I've read, I know that essentially, I think you mentioned this, that they all have a different way or journey, as when you take it, the journey might be a little bit different. The end result tends to be very similar. But with ketamine specifically, do you feel that the reason why it's legal, or at least here in California is more accepted? Is it because it's less hard, less harsh? Because I know with certain others, like ayahuasca, for what I've read and seen on TV, it seems like it's a pretty harsh journey to go through. I mean, it takes hours. I've seen people that, just in the videos that I've seen, and there's tons of stuff on YouTube too. People get really, they seem very sick for hours, and so, and then with MDMA, I've read that there's actually, like you said, a lot of clinical trials because it's pretty quick. It lasts a few minutes, and it's usually very effective. But I don't know the intensity of it in that time frame. I don't know if it's too intense. But with ketamine, would you say that it's less harsher, intense? Is it a gentler approach to psychedelics?
Yes, and what all has gone on to make it legal in the state of California, I honestly do not know. I know there are many hoops, and they've been working on it for a long time. Greg Wright knows a whole lot more about that, and he would, I'm sure, love to be interviewed by you at some point if you like. I'd be happy to set that up.
That'd be awesome. Yeah,
that would be wonderful. He's such a good person too. So the ketamine, yes, it's very gentle, and it's very short acting. So when the patient is having an infusion, the effects of the drug last as long as the infusion, and then shortly, just a little bit thereafter. So they come into the office, they, get all comfy to receive the infusion. And that goes on for about an hour, and then, then slowly, come back out of it, and they're good to go. So compared to LSD, that could be a 12-hour experience. And so that's extremely intense and extremely prolonged, and all kinds of things could happen.
And it could be dangerous, right? I mean, if you don't go to a trusted source or a trusted companion as you're doing this journey, I mean, I could imagine it could be very unsafe.
Yeah, and and just by virtue of the fact that it's going on for so long, any other number of elements could happen, to interfere, to, get like a bad trip kind of thing. And the setting, as Timothy Leary would talk about all the time too, is so important. So you need to be in a really safe place with really safe people, so it needs to be comfortable, and ideally there should be some nature, and so that's the nature of our I guess our so-called healthcare system, is that everything has to be regulated. Yeah. And so in the ketamine clinics, it's extremely regulated. It's extremely safe. It's very contained. There is supervision for the entire time, right? So peyote, psilocybin too, sometimes, definitely ayahuasca, you'll vomit, like almost guaranteed. And, that is not appealing. That is not pleasant. Under the sort of ritual of tradition where they're practiced, but where unless you're just taking it, it's a party far from the bushes. If you're doing it more ritualistically, it's pretty safe. There are guides, you're taken care of. But those experiences are few and far between, and may involve travel to Costa Rica. Or South America.
And that's what I've seen. There's a lot of tourism now, right? Related to that. Yeah. And I personally, I believe that there's a lot of, also, I'm sure there's really authentic, genuine healers in those places, but I'm sure there's also people that just take advantage, right, of the need and the desire for healing that people have, and that search that they're on. And I feel like there's a lot of room for abuse in that regard, right?
Absolutely. Exploitation in every way, from financial to sexual.
Absolutely.
Sideways. So unless you really know where you're going and who's in charge, then you'd be very careful pursuing that sort of path. So for someone who does not have any experience, then the ketamine clinic kind of experience is the safest, most gentle, sort of rational, intelligent thing to do, I think, in this quest. If you have some experience, or you're just super adventurous and not afraid, do your research, for heaven's
Yeah.
sakes, do your research. But there's value in those experiences too, of course.
Yeah, of course.
But
and, we haven't really talked about, and I just want to touch bases on. So this is something that like if there's a lot of research coming out on the benefits to help patients that are chronically depressed, not responding to medication, or patients with PTSD, anxiety. In your experience, just in your own clinical experience, what type of diagnoses, or what do you say this is the most helpful for, or not necessarily diagnosis, but just difficulties in life, difficulties? What do you feel that this psychedelic assisted therapy, who do you think this is best for? Because I get the sense that this is not for everyone, right? So just, someone experiencing depression for the first time, it's, I just don't, unless there's, of course, a chronic history of trauma, and, it's just coming out now because maybe they just had their baby for the first baby, postpartum, and all of this comes to the surface, which could happen, right? But I get the sense that this is for those, and correct me if I'm wrong, but for those that have been on a journey, that have tried other things, and nothing really sticks, like you said, nothing is really working, or nothing is giving that lasting change that you look, or sustained change. I don't know. What are your thoughts on that?
Well, I agree. I think with what you're saying, and definitely not for everyone. And here's another famous Timothy Leary quote. He says, "Don't give Cadillac drugs to a Volkswagen brain," and which is not to demean anyone who's not interested in psychedelics at all. But it's not for everyone.
It's not for everyone, exactly.
Yeah, not everybody wants or is remotely interested in a transcendent experience. So you have to have some inclination to that in the first place.
And not everyone needs it too, right? There's people that are perfectly happy with their life, and I've heard of people, right, that they're perfectly happy, and then they come across someone that has access to this, or knows someone that, and then they come out of that just really, really just worse, right? That they come out of that with these memories of other things that have happened to them, maybe did or did not, maybe, and they're just very, very overwhelmed, they're triggered, they're dysregulated, and it's like they were fine before, right? They
I don't know. So why, I'm full of, I feel like little platitudes, but if it ain't broke, don't fix it. And also, I think anyone that would move forward with such a course of treatment definitely has more going on than just being perfectly fine.
So you feel like this is almost like, if this happened, or if you were curious about this, there's a higher reason guiding you to that, or
you're looking for something. Now, clinically speaking, in order to qualify for something like a ketamine assisted psychotherapy, then they would need to have a medical diagnosis like major depression, post-traumatic stress disorder, even extreme anxiety disorder. Very appropriate in the treatment for all of those things. Any of those things, any combination of those things. But somebody who is, like I say, perfectly happy the way they are, they're not going to be looking for this kind of experience. And then if by some, series of circumstance, their friend is like, hey, let's, try this crazy psychoactive psychedelic drug, and they say, sure, I'm up for that.
There is something there already, right? Guiding you to that.
Might have a bad experience because they might not be ready for that.
Right.
Definitely not for everyone.
And that's what a lot of people don't talk about, right? Especially in the media, on YouTube, and all these shows. I've seen so many shows on Netflix too on this. They just focus on the glamorous part of it, right? The accessing higher consciousness, and but the reality is that, like you said, it can be pretty harsh, to come out of that, and recovering from that can be pretty harsh.
And especially without the proper sort of support and guidance, and it doesn't, I'm not saying it has to be a professional. like
Someone
me or
that,
you. It
yeah,
could be just someone,
that's
whose heart's in the
experienced.
right place and they have the experience.
Yeah. And it's safe, right?
Yeah. Yeah.
Someone that is safe to go
Yeah.
to. Yeah. Yeah. And for the clinic that you're connected to, or I guess just in general, but do people need a specific referral from a doctor, or is it self-referral? I mean, how does that work for ketamine?
They can go directly. They will need a diagnosis, to
Mm.
begin their treatment, and that may be provided by a therapist like me,
Uh-huh.
or a psychiatrist or a doctor, any other doctor can
Mm-hmm.
provide that diagnosis.
Mm-hmm.
And then, the treatment can proceed because it is a medical model still. So you can't just say, let's do this.
Yeah,
There
yeah.
has to be
No,
some clinical reason. And
yeah.
as a therapist, like a ketamine clinic will do this infusion therapy with anybody with an appropriate diagnosis. As a therapist, I really believe in vetting those patients and doing at least
Okay.
a session or two before the first infusion. Identify what is going on, what are they working on, are they prepared, and desirous really of finding this,
Yeah,
higher dimension
exactly.
consciousness. And, if that's all a go, then yeah, let's do this,
Mm-hmm.
and what an opportunity, really incredible. But
Mm.
definitely not for everyone. And I would say also as a therapist, I am inclined to say, well, have you tried therapy? Have you tried meditation? What sort of real behavioral changes have you made to
Right.
address this problem?
Yeah, yeah, because
Getting any
the
exercise? Are you eating
right.
healthy?
Yeah.
Are you living on caffeine and fried food? I don't
Yeah.
know. These are things I think it's important to assess
Yeah.
before, sort of a holistic kind of,
So
assessment.
what you're alluding to is that this is a component of treatment. It's a
Yes.
component of healing, I should say. It's not everything, right? There's other areas of your life that you can do everything else, but if you don't work on your nutrition, for example, or you're like you said, if you're not taking your medicine, if you're diabetic and it's all, the mental emotion, it's all connected, right? Spiritual, mental, and physical well-being. And if one of these is missing or not being addressed, you can only do so much in one and the other area, right?
Yes, very much so, which is right back to what, when it's not sticking, in order for it to
Exactly.
stick, these other things need to be in place too. Now, that said, we both know plenty of patients that have no interest in doing real therapy. They just want the drug.
They want the quick fix, right?
They want the
just
quick fix, or the
magic wand,
Prozac, or
just
the
fix me.
Zoloft, or the
Yeah,
Ativan,
yeah,
or
yeah,
whatever it is, Lamictal.
yeah.
They just give me that drug and let me go. Right. And so, okay, well, then I guess I can't really help you much as a therapist. There are such people, patients, clients, whatever you want to call them. And we got to wish them well. Okay, but that's okay.
Yeah.
That's working for you. I hope it's working for you. Off you go. Same
and
for
it does
ketamine.
for some people, right? For
it
some
does.
people, yeah.
It's good enough.
But like you said, you as a therapist, you're there in your office, and you're like, there's more to it, right? There's
right.
so much more healing that you need to do that the medication is just not going to.
That's right.
Do for you. It's not going to do everything.
Yeah.
You have to do the work.
That's right. You and I,
the emotional work.
Plumb the depths and figure out where it came from, what's really going on, and here's the things that we need to do for you to feel better. And if you're not doing all of these things, that's not going to, you're not going to really get there and stay there. And it's a maintenance thing too. You have to keep doing this. So just like someone who just wants their Prozac and, I'm okay, the same could happen with a ketamine infusion situation. They have their diagnosis, they do this drug, they feel better for a month or 6 months, then they get another infusion. And that type of treatment is not something that I really advocate. But I know that people are doing that. And these tend to be people in very high power kind of position, like workaholics, for example. Workaholics, their mentality, and that is also an addiction, right? They don't have time for that. They don't have time to do the deeper
do the work. Yeah.
They just want to feel better and get back to it. And this type of person may do a ketamine infusion like once a month or every couple of months or whenever they feel like they need it.
Yeah.
And clinically it's indicated, because they have this depression, they have this trauma, they have this anxiety or whatever. And it's very helpful. And if that's what they want and they can afford it, then okay. I don't think that's healthy. I think they need
I agree.
more real, deep dive kind of exploratory therapeutic, enlightening kind of work in order to actualize themselves.
Right.
And then,
Absolutely.
to be
And Diana, as in your role, as a psychedelic or ketamine assisted psychotherapist, in your role, would you be in the room with them as they're going through this process, or does this something that they do afterwards or in between sessions? How does it work? And just for fellow therapists out there that are interested in doing this, just to get an idea. So what is your role, or maybe there's different approaches to this?
I would say sort of any of the above in a way. Depending on what the patient wants and needs.
Okay.
So they want someone with them before, during, and after the actual infusion session. That is certainly appropriate and acceptable.
Oh, okay.
Where I feel like what really needs to happen is at least 1 to 2 sessions beforehand or more, depending on the patient. And then begin the infusion process. Being there at the time of the infusion is not that important because the nurse is there and they're not necessarily going to be talking at all.
So
if they don't
got it.
want the physical support, or they don't, it's
to
not
feel safe.
it's not necessary, but it might be.
Okay, got it.
I feel that the before and the after.
And
the after might not even be until the next day or the next week, where they maybe make some notes, do some journaling about their experience, things that come up for them afterwards, to then be able to process.
To be able to process that, because I could imagine for the whole purpose is to have these shifts, these emotional, psychological, or spiritual shifts within you, so you can feel better. So I'm sure there's so much processing that happens right after a treatment, that how do you contain that? If you don't have therapy, I don't know, for those that don't have a therapist, do they journal? I can't even imagine another way to contain this, the aftermath of this, the emotional and spiritual aftermath of all of this. I'm sure some people don't need to, right? There's
some people don't want to.
And they don't want to. They can just get up and go. But I'm thinking of the way I am. I know I process through talking, and I would need to have that. So I can't imagine someone not having that support afterwards.
Yeah, no, me neither. And even just for example, over the many years of getting dental work done, I would always opt for nitrous oxide for my dental work. Which is another extremely powerful hallucinogen that I believe would be very appropriate for this type of therapeutic work, which is not approved for that. But, the dentist office, you can get it for your dental work, and it does induce this, extremely transcendent kind of experience. So even after just doing that over the years,
interesting.
Dental work, a filling or a crown or whatever.
And any dentist can do this?
Not any dentist. They have to be licensed, and they have to be willing. Not all dentists will do that. But I'm a big advocate and huge fan. It makes dental work a breeze. And and you come out the other side with wow, well, that just happened. So even
that's amazing. I just with a lot of patients with specific phobias and traumas related to, it's such a huge need for that kind of support. There's so many people that they don't go to the dentist for years.
It's
because of this fear or trauma.
That's right. It completely changes the experience, right?
Okay. Thank you for sharing that.
Oh yeah. And so after those experiences, which don't happen every year, but since I discovered that was a possibility, that's a thing you can have, then I would come out the other side of that needing to talk about it and share it. And to sort of, try to attempt to remember some of those things. And as I said before, having that experience of, well, what was that? I can't quite put it into words, but I was there. I could feel it, I could see it, I know it.
Yeah.
So just being able to share it on that sort of, very undefined kind of level has been so helpful and meaningful.
Yeah.
So I don't know why anybody would, except like I said, like a workaholic, or just like, or maybe they've got a bunch of kids and they just don't have the time, they can't, just go.
Right. Yeah. I mean, or sometimes they just don't want to deal with it, right? It's too much to even, so
that's right.
They just compartmentalize and they put it away.
Forget it.
Yeah.
And for some of the real, trauma stuff, sexual abuse, especially, childhood sexual abuse, especially, there is an inclination to I just want to forget about it. I just want to feel better and forget about it. And it will help to do that. But my personal belief and experience is that work needs to be done around that for true healing.
Absolutely.
It might be good enough, and I need to accept that good enough is good enough and let go of my control issues. No, but we have more work to do. We're like, well, okay, you're good. Okay.
Yeah. And I believe, like I said earlier, we're all work in progress. We're not done until we're done, with, at the end, but
and maybe not done.
and I believe in that too, right? That we're not done and we're going to come back, but that's a whole other topic.
Yeah. Here, there, or somewhere. Yeah.
Yeah. So, but honestly, like it's, and there's for a lot of people, I've noticed there's this, and I think it's okay, because it pushes you to start your healing journey, but there is a sense of urgency to just do everything and just get it done, and then I'm going to feel better. And the reality is that it sets you up to be disappointed, because you can do all of you can do everything, and you may still not be there, right, where you see yourself in regards to healing. And it's just a journey, but if, like you said, if it's good enough for now, I will take that, right? I will be good for now, and I'm okay with that. And being, we mentioned the component of acceptance, just being in acceptance of where you're at, regardless of what point that is in your journey.
So it's such a key, acceptance, and it's also for so many humans, that's where our resistance really digs in. Is that, I think, somewhat our nature, our defense mechanisms, maybe it's a caveman thing, that if I deny it, then it doesn't exist. Don't talk to me about accepting my abuse. Because it's just a misunderstanding of what it really means. And this is what is really facilitated by these therapies, is peeling through the resistance into the true acceptance, where it's really okay. You're already okay. You already have what you need. You already are who you are. You're a perfectly divine and flawed human being, and it's all okay. Whatever happened has caused no permanent damage to your true self, to your soul, if you will, to your divine nature. And many times these traumas do inform our development, and they certainly do affect us and wound us in some ways, scar us even. But underneath all of that, and that's the layers of the onion that everybody talks about. Underneath all of that is this divine presence of knowing and perfection.
You're already inherently good, whole, perfect. When you, like you said, when you peel the onions and you get to that core, you're the source of who you are. You are good, right? You are good. You're whole, and you're nothing. I think I deeply believe what you just shared, and I thank you for those words, because it resonates with me in my own belief about life, and humanity in general.
And when used properly, safely, we can peel back those layers, with rapid success, where if we're just sort of hammering away with sort of cognitive behavioral and, just
there's only so much that can do, right? There's only so much anything can do, where there's limitations to everything. That's why it's important to take what helps you from one approach, take it, go with it, and then see what else is out there, right? To continue your journey. And well, thank you so much, Diana, for coming on and sharing your knowledge and all your wisdom. I really appreciate it. And
it's my pleasure. I'm so sorry. Hold on one second.
Sure.
Okay. Sorry about that.
Oh, no worries. So, Diana, if our listeners want to learn more about you and just read up more about your work, how can they find you? How can they connect with you?
So I have a website or a web page. Actually, it's still in development, but it's not too bad, and I can be reached there by email, and that's DianaLittle.com. So DianaLittle.com, and I would love to hear from anyone and everyone with any kind of interest in this or traditional psychotherapy as well.
Okay.
And I read tarot cards and have done since I was a teenager.
Yes, and we didn't even touch on that. That's another amazing part of you, and I know that we've shared a lot on that personally.
So that's That's really fun, and
absolutely.
Many people certainly enjoy incorporating that into their therapy. And in private practice, I can do that. So
absolutely.
I'm excited about doing that type of work too. So, for readings, therapy, and or ketamine assisted, I'm the one, I'm the girl, and there are others as well, of course. But I'd be most happy to hear from any of your listeners. Thank you so much for having me.
Great, thank you, Diana. Okay, I'll see you next time.
Okay, bye.
Bye. I hope you enjoyed this episode. I hope that you found it healing and nourishing to your mind and soul. If there's a friend that you think would benefit from listening to this information, please share it. Share about our podcast. If you feel called to, please leave us a review, as this really, really helps boost our presence here in Apple Podcasts, and it makes it easier for others to find us. To stay up to date on new episode releases and special events and projects that I'm working on, you can follow us on Instagram at Inner Healing Paths Podcast. And you can subscribe to my newsletter by going to my website, which is rosachettilcsw.com. And I will include this information and links in the show notes. Once again, thank you so much for listening, and I look forward to sharing with you again next time.